Hello, welcome. I am your ENT, your ears, nose, and throat doctor, and I will be assessing you today. Your physician did send you here simply so we can find out what is causing your throat discomfort. So I do know that looking at your files that you have seen another doctor to clean out your ears, correct? And according to the files, everything was looking just fine. So I will still take a quick look inside your ears and then we can go forward. Great. So first, I'm just going to listen to your heart and lungs, and you can just relax and sit comfortably. Okay, good. Okay, how was your day? It's good. I know you've been experiencing some pain as of late, but don't worry. We will find out exactly what's going on. Okay, if you can just relax your shoulders for me. Great. And I'm going to go ahead and come in now. Okay. So you can give normal breath. Very good. Okay. And just here. Good. Okay, good. And you can go ahead and take a deep breath in through your mouth and out through your nose. Okay, good. Okay. Good. Very good. Okay. Very good. Okay, very good. And I'm just going to go on the side here on your back. And you can take a deep breath in. Yeah, just take a deep breath in through your mouth and out through your nose. Good. Very good. Okay. And the side. Okay. Very good. Perfect. Okay. So now I will be checking your ears, and I will be checking on both sides just to ensure that there isn't any infection or obstruction, any damage within the ear, the inner ear, and we can help assess whether or not the pain is coming from the throat or perhaps the ears. Okay, so I'm just going to take a look very gently, okay? Okay, great. Right, so just coming here. Okay, so let's take a look. Just going to take a quick look here. And I'm just checking inside and making sure that we get a good look inside your inner ear. And so far everything is looking very normal. over here and you can relax your jaw. Thank you, yes. That does help me to properly put the scope in. Thank you, yes. And you can just keep your head nice and straight for me. Perfect. Okay, well, everything looks very good on this side too. So I don't suspect that it has anything to do with your ears. Okay. Very good. So your ears are looking absolutely fine. They're very good for color. There's no obstruction or any kind of infection, any severe inflammation. Everything is looking quite healthy. Very clean ears. Oh, you had them cleaned before. Good, yes. It's very important to keep them nice and clean and healthy. Alright, very good. So now that your ears have been checked, I do want to look deeper into your throat and make sure we get a scope in there and take a good look and see if the issue is in the throat. Okay, good. Okay, so first, I just want you to relax your jaw and just feel very comfortable and calm. Yes. Good. And I'm going to just take a quick look just into your mouth and nothing invasive, okay? Okay, good. So relax your mouth, relax your jaw, and I'm just going to. Perfect. Alright. Okay, so I'm just taking a quick look. Just a quick superficial look in the mouth. Good. And just looking around the tongue and noticing the coloring. It's very good. I'm just going to take a quick look here. Okay. Okay, the teeth are good, firmly planted, and the tongue is a good pink color. Okay, just here. Okay. And if you can just stay on. Good, thank you, thank you. Alright, I do notice that there is inflammation at the back of your throat. A little bit of some redness, yes. So I'm going to take a quick look there, just at the tonsils. Okay. Well, there's no pus, so I don't suspect that this is viral, but I will have to take a look with the scope. Okay. Okay. Good. And just here on the side over here. Good. Okay. Okay. Very good. Yes. Okay. Now I'm going to be putting a scope into your mouth and looking into your throat. And I will be putting a numbing spray into your mouth so you don't feel any discomfort or the sensation of gagging. Okay, so I will get the spray for you and simply put some sprays at the back of your throat and the back of your tongue. And then this way I can put the scope at the back of your mouth without any discomfort whatsoever. Okay, great. Okay, so I do have the solution here, and it is a tasteless solution. You might notice a little tiny bit of mint flavor, but other than that, it is a very tasteless solution. So I will spray some into your mouth, and then you will notice a soothing, numbing sensation starting from the back of your mouth and down your throat. It is a very interesting feeling and very relaxing for a lot of our patients. Yeah. Alright, so you can go ahead and open your mouth. Good. Perfect. Okay, so I will be inserting the scope into your mouth, and it will simply be showing me the images of your throat on my computer. I will also have a syringe to remove any saliva that builds up, since you won't be able to feel that now that your mouth is nice and numb. Okay, so you can go ahead and open your mouth for me. Good. And I'm just going to put the scope in, okay? Alright. Perfect. Good. And the computer is simply getting the images of your throat. Good. You're comfortable? And I'm just going to remove the scope. Good. Okay. Very good. Yeah, it wasn't so bad. So I have taken a look at the results, and everything is totally fine. But I have noticed that there is the beginning of inflammation just along the sides of your vocal cords. Yes, and that can simply be from acid reflux, or perhaps it could be from vocal strain or emotional stress. Do any of those seem more likely? Stress. Yes, so we call this muscle tension dysphonia. That simply is a term for stress in the vocal cords from tension from outside sources. Sometimes people get this from singing incorrectly or speaking incorrectly, and often breathing patterns aren't quite strengthened or practiced. So these are simple things that can be adjusted. Yes, I know that you have some tension in your jaw and your throat. So that definitely can contribute to muscle tension dysphonia. So I would like to go through a series of relaxation techniques to calm your jaw down, and in turn will calm down the rest of the muscles here. So I'm just going to feel along the sides of your jaw, and this will help indicate where you're holding that tension and stress. And then we will simply do a couple of things to help alleviate that. So I'm going to come here and just press along your jaw. Okay, just going to press here. Feel. Okay. And let me know if you feel any pain or dull feeling or sharp feeling. Let me know if there's any discomfort whatsoever, okay? Just feeling around here, just on this side here, this part of the jaw. It's very tight. How would you describe that? Very sharp right here, okay. And when I massage it, how does it feel? Very good. Okay. Yes, so the jaw is very much the hub for tension along the throat and even here in the upper chest. So we are going to relax your jaw first, okay? So first, I will be massaging your jaw by doing a series of circular motions just along the base of the jaw. Yes, this is where most people clench. Yes, often in a stressful situation, you might do the clenching from the fight or flight response. Both responses induce stress hormone and cause clenching. So that could definitely be the source of discomfort. Okay, just feeling here. Good. And we're just going to feel along the jaw here, okay? Yes, there's a lot of resistance right here. You can feel that. I understand it can definitely be something that goes unnoticed. Yes. So I'm going to massage this part of your jaw by pressing underneath the tongue area. And often a professional can feel where the tension is hiding simply by feeling the tongue here. And if there is a strong resistance, then chances are it is coming from the jaw. So I'm feeling here, and it's very hard. Yeah, just feeling right here. Okay, so I'm going to massage that out. Good, and I'm just going to make sure that we loosen up this part, okay? Good. It feels better already. Good. Very good. Yes, you respond quite well to massage. I can see that you're already relaxing so much. Good. Good, just here. Good. Good. And just like this, okay? Very good. Just try and release any kind of stress that you may be holding on to. Good. Much better. Yes, so I want you to practice doing that when you are at home and you feel some kind of stress. Just massage underneath your tongue here, okay? Good. Okay, well, I'm definitely happy with how you are progressing simply from a few techniques already. And I think if you implement these techniques, that in no time the inflammation will go. I do want to relax these muscles here simply by putting my fingers underneath and lightly pulling downwards. And this here will help relax the muscles and the vocal cords. Yes. And this is very helpful when you're in the shower and there's hot water. It does help the inflammation and any tension build up. Yes, very good. So I'm just going to pull down this way. Very good. And any tension you're holding on to, just let it go. Good. Good. Okay, very good. Yes. I can see that you're already breathing better. I'm going to ask you, though, to pay attention to your breath whenever you're feeling any kind of stress. Okay? Simply because in stressful situations, we tend to stiffen up and breathe from our chest. Yes. And this is certainly an effect that will be very hard on your vocal cords. If you're speaking loudly or even quietly and taking breath from your lungs in short, superficial ways, you are going to be straining the vocal cords more frequently. Yes. So, we do want to practice our breathing from our diaphragm. So simply think of your diaphragm like a balloon. And when you take in breaths, take them into your stomach and abdomen and feel the sensation of the balloon expanding. You can try it, okay? So I'll put my hand on your abdomen and you can breathe in and out. Very good. You want to try again? Yeah, it's a different sensation for sure. Okay, go ahead and try again. Breathe in and out. And you can immediately feel the stress just floating away and melting off your body. Yes. So mindfulness is key when you're experiencing any sort of tension, as it will help take away the stress and you won't internalize it on the body. Yes. Okay, you're learning so fast. You'll be better in no time at all. Okay, so I'm going to also press on your ears a little bit and see if you're holding any stress here, okay? How does that feel? It's okay? Okay. Just checking here, just a bit over here. Just going up and down the back of your ear here. Good. Okay. And just pulling gently. Here. How's that? It's okay? Okay. And just on this side. It's okay. Yeah, you felt most of it over here. Okay. Well, you did a very good job for your first session. I'm very impressed. And I do want you to spend a lot of time, a lot of time relaxing, taking nice warm baths, spending good time away from any sort of stressful trigger at all, okay? I just want you to simply find some peace and quiet and whatever brings you a calm feeling this week. I want you to practice that, okay? Yes, and when I see you next time, I'm sure you will be all better. Good. Alright, well, you take care of yourself, and I'll see you again soon.